Thank you so much. It's a pleasure to be here. You know, the energy in the room, even yesterday, was just palpable. This is the most attended meeting. It's the best sponsored meeting, more record number of members, and the end of my first year, so I'm going to take credit for all of that. But no, really, we have to really, I think, pat ourselves on the back and give ourselves a round of applause for not just being here, but for all the work that we've done. So I just feel like the energy in the room this last day and hopefully this today and tomorrow is really going to energize everybody. So let's give ourselves a round of applause just to start. So I'm just going to briefly go over what progress we've made as a roundtable. Does this? Here we go. So the 80% in every community strategic plan. Many of you who were here 3 years ago, the last time we met in person, remember that we launched the strategic plan, which is listed here. The focus areas that we kind of agreed upon and we're working on were to assess and build capacity, to catalyze healthcare systems, to mobilize at public touch points, and to break down policy barriers. So let's see what kind of progress we meaning the community at large, all of our efforts have done. So first of all, everybody's aware of this, but I think we really need to take a moment to just recognize that nearly all major guidelines now recommend colon cancer screening for average risk adults starting at age 45 with nearly full implementation by 2023. This started out almost as a dream back in when the ACS was the first to really launch those guidelines in 2018, and here we are just a few years later with this implemented. So this is a big win, given especially the troubling increase in young onset colorectal cancer. And many of you were here yesterday and saw some of the data from the various metrics that are often kept every year. I'll just briefly show some of them again. This is the BRFSS measures, which is a self-reported measure, and you can see that the rates were going up consistently, and that's a trend we've been seeing ever since, for a good 10 or 12 years now. This is the National Health Interview Survey, similarly showing increases as time has gone by. Again, a self-reported measure. And this is the UDS measures for federally qualified health centers, which we know have lagged behind historically. And although we were disappointed by the drop in rates related to COVID-19 pandemic, I think it's kind of impressive that things are picking back up rather quickly in those environments, and really in many other environments as well. So we definitely took a hit during COVID, we know that. But it seems like once people started really getting back to work, they gave priority to high-risk people with positive stool test symptoms, things like that, family history. And I think we're going to see a very rapid recovery, which is very encouraging. One of the problems that we're all painfully aware of is that things are not equally distributed. So UDS rates, for example, are as low as 25% in Alabama, but as high as 61% in Maine. So these efforts are not universally distributed around the country, which is why our theme of 80% in every community is so important to really get to areas and pockets of the country where it's needed particularly the most. And then finally, the HEDIS measures, we heard this yesterday, both for commercial plans and for Medicare, they seem to have somehow consistently stayed where they are even during the pandemic. So I think, again, encouraging that we're still on track and hopefully we can go higher and get to the 80% measure. I think these two policy successes, to me, are probably the most important things that we've done as a community in the last few years. So most of us are aware that in December of 2020, the Medicare loophole was fixed that basically now eliminates cost sharing for patients who have a colonoscopy where a polyp is found. And it used to be that if a polyp was found and removed, the procedure got coded as a diagnostic study, not as a screening study, and patients were stuck with a bill. That no longer happens, and that took a lot of work for many, many years from many people in this room and elsewhere. That was a huge win. The other huge win was the cost sharing for colonoscopies after a positive abnormal non-colonoscopy screening test, a stool-based test or CTC. Private health plans and Medicaid expansion has to now eliminate cost sharing. You may also be familiar that if a patient had an abnormal stool test, the colonoscopy was not being covered because it was then considered a diagnostic test to follow up on the screening test. But that is now gone, fortunately. And Medicare lowered the screening age to 45 and will eliminate cost sharing in Medicare plans in 2023. And importantly, CRC screening was added to the Medicaid core set. So these are huge policy successes. And we've always focused on policy. And I think one of the advantages of this organization is that it brings together clinicians, policymakers, payers, all in one room. And really, I think it's to our collective credit that this happened. And I really appreciate all of the advocacy organizations that go to Capitol Hill and really advocate for this. These are huge wins for our patients and are game changers, frankly. Great. And we've heard about the President's Cancer Panel report. This was also a huge release back in February of this past year. It really highlights the role of roundtables, increasing financial support for the NCCRT and also the National Lung Cancer Roundtable, but also talks about creating roundtables for breast and cervical cancer. And we're really fortunate that John Williams, who ran this whole project, is here today and will speak to us. So a word or two about our achievements and our resources. I don't know where this has to be pointed. There we go. So you should all be aware of this if you're not, and that is we just recently, in August, released the STEPS Guide. This was first released, I think, in 2014. At that time, it was a huge success. There were many, many downloads. Many, many people utilized this, and now it's updated. And I really draw your attention to this. Take a look at it, download it, because it has everything you would need in your environment, whatever your environment is, to really get things done. There are the guidelines and test options are in there. There are expert endorsed strategies. There are case studies. I think there's like 10 different case studies. There's a colonoscopy calculator. You can calculate based on your micro population what kind of colonoscopy needs you might have. It's amazing that just about anything you can think of to help you do your work is in the STEPS Guide. This took an enormous amount of effort over several years. And so please, if you haven't seen it, go to it. It's hot off the press. It's very, very current and very useful, very practical. And also quite new in this past year was the messaging guidebook for Black and African American people. This was also a huge effort based on very careful marketing research where people interviewed individuals from Black and African American communities, learned what their concerns and fear were, what kind of messages could get across. I strongly recommend that you look at this as well because you can easily adapt it to your local environments. We had a primary care strategy meeting this summer. The basis for that was we all know that lowering the age to 45 puts a lot of pressure on primary care providers. The COVID pandemic really put a monkey wrench into all of our operations, particularly primary care operations. And we've all known forever that people get into screening in the first place through their primary care provider. So we felt it was really important to have a full day devoted to what can we help, how can the roundtable help the primary care community really do their work, especially in the modern era with age 45 and even COVID issues. So we had a meeting and we really appreciate the input from our primary care colleagues where we are developing strategies to help better support these clinicians. So take a look at that document. It was really, I think, to me, it was extremely helpful in understanding what some of the needs and concerns are of the primary care community. And also a new resource that you should be aware of is an employer resource. So whether you work at a cancer center, a nonprofit, a health plan, whatever, whoever your employer is, there now are resource guides to help employers ensure that colorectal cancer screening is a priority in their workplace. You know, if we think about it, we started thinking about this in New York City a few years ago. We sort of called it InReach. If each of us in our organization could make sure that the people that work in our organization are screened, that would be a huge win. And so many of us work in healthcare where people have insurance, they're covered. It would be helpful if each one of us in our local environment made sure that the people in our workplace got screened. And so this is a resource really meant for the employer, not for you, but you can bring it to their attention as well. And upcoming is a lead time messaging to encourage on-time screening. We have had a whole conversation about this for many years, and I give Whitney Jones, Paul Schroy, and the late Dennis Onnen a lot of credit for really moving this whole concept forward. And that is that, especially now that young people are supposed to come in at 45, it takes time to get the message through to people. It takes time to get the message through even when the age was 50. So this whole notion of lead time messaging and on-time screening, those are really, really important messages, and we have a resource that will be released soon. So our strategic plan priorities, you may recall last year, although I know everything was on Zoom, we have 3 priority areas that we focused on. One is on-time screening as soon as eligible, whether you're average risk or increased risk. Timely colonoscopy, follow-up of an abnormal stool test, not waiting too long for the colonoscopy, and then understanding and addressing the source of CRC disparities. We had a steering committee retreat this summer, and we looked deeply into these 3 priority areas to see if they're still the ones that we want to carry forward in the coming year. We always do an analysis every year. And basically the same 3 categories are staying, but we've prioritize them, we include them a little bit differently, and we realized that there really weren't any action verbs in this document. So with the new version, let me go back. With the new version, here we go. The updated priority areas, we actually are placing the most important emphasis on health equity. So that becomes number 1 instead of number 3, and we really want to mobilize national and community level efforts that will really help health equity in CRC screening. We want to support on-time screening as soon as eligible and continue participation over the years if you're doing FIT testing or stool DNA testing, and promote timely colonoscopy follow-up to a positive abnormal non-colonoscopy test. So these are same priorities. Again, everything we do, I think, has to have a lens of health equity to it, but also action. And you can see here that these are going to be our priorities going forward. So, a word or two about our time together during the meeting. Today, we have an incredible lineup. The first panel will be screening at 45. We're going to go over data, research, and implementation. We have some of the country's top experts in this. It's going to be very, very fresh and very relevant to all of us. Then we have a panel to follow up abnormal non-colonoscopy testing, moving from policy to implementation. Again, a very, very tangible and very timely topic. And then there'll be an armchair conversation after lunch on implicit bias in healthcare and the impact of survivorship. John Williams will speak to us about the President's Cancer Panel cancer screening report. And then this afternoon we have concurrent sessions where some of them will be replicated tomorrow morning, not all of them. So you'll look in your program and decide where you would like to go. And then please, please come to our networking reception at the end of the day. That's one of the most fun places to meet people, have a few drinks, and really see old friends and make new ones. And then tomorrow, we have the NCCRT Strategic Priority Team snapshots where The groups that met yesterday will report back to everybody. We'll hear what each one of us has done yesterday and plans to do in the coming year. We have a Distinguished National Leadership Award that's going to Stoney Anderson. Lots more about that tomorrow morning, but Stoney is so well-deserved to get this award. He's been such a faithful member of our community, and more than that, contributed some really ahead of his time concepts that we all had to finally get around because he was way ahead of us. What the recent election means to issues that we care about, we'll have a session about that. That may be on a lot of people's minds, and this meeting always falls right after the election, so that's going to be very timely. There'll be some more concurrent sessions, again, some of which overlap from today, and then innovations in cancer screening and prevention, again, how to lay the groundwork for health equity, and then we will close. And you will not want to miss the very end of the meeting. Not only because the lecture before on health equity is going to be given by Rich Wender, and I guarantee it's going to be a very, very important talk, but because at the close I will sing a song in keeping with Dr. Wender's tradition of singing at the end of the meeting. You know, Rich set such a high bar for me, you know, because he was always... He's got talent. I don't really have that kind of talent, but so I really need your help. And I think you'll find that if you come to this last session, you will be able to help me sing this song. I think most people know it, but anyway, that'll be a fun way to wrap up and leave the meeting. So I think I'm done. Oh, yes. Please engage on social media. This is how you reach us. Share on Slido. Dave Greenwald is in the audience. He's the head of all of our social networking efforts and is a master at this. So if you don't know Dave, you should get to meet him, and he can connect you to the entire world of colon cancer screening. And I think that's all I have to say. So I will have time for a few questions if anybody would like to say anything or comment or questions. So thank you very much for your attention, and I really look forward to speaking to a lot of you in the next day and a half.